Well, thanks for joining us today, Malcolm. Really good to have you with us. I suppose as a bit of a starting point, it'd be great just to get, I suppose, a brief introduction on yourself and sort of your background and your experience today.
Sure, Jonathan. So I've got a kind of fairly long professional background behind me, but it kind of breaks down into almost two equal halves. First 25 years spent working around the world in range of roles for large multinational companies, finishing in a couple of CEO roles, leading restructuring. And at the end of the 90s, I felt I wanted a change. I wanted to move out of what were the classic turnaround challenges into something a little bit more growth oriented. And I felt it was probably the last time as I got to my mid 40s that I could do something more entrepreneurial. And I found a healthcare business, a shell that I was doing some investment appraisal for on behalf of some advisors. And it turned out to be the opportunity to effectively start my first buy and build in the dental sector, and led to the development of a business called Oasis, which I think was the first branded dental chain in Europe, which we launched at the end of the 90s, built pretty successfully. I exited before the first buyout of the business by private equity, and went on to be involved with a number of other healthcare businesses, chairing the AIM-listed Synexus Group, selling that to private equity, then doing another dental buy and build for another private equity firm, but this time in mainland Europe. So building up quite a large group in Holland and Switzerland, which was sold to private equity a couple of years ago. And I'm currently exec chair of another healthcare business, which I co-founded, which deals with the treatment of prostate cancer, and also chairman of a children's nursery group. Again, both under private equity ownership.
A lot of experience there, Malcolm, both, I suppose, exec career, non-exec career. And I suppose one of the themes that we particularly wanted to, I suppose, pick out with you today was that sort of buy and build theme, something that you've done multiple times. So I suppose as a starting point, from your perspective, what are the key factors in a sort of successful buy and build?
Well, I think a number of ingredients come together. First of all is the entry point. Are you a pure startup, or are you acquiring an established platform? If it's a pure startup, there are lots of benefits for an incoming owner in terms of shaping the business, building the culture, creating a platform which conforms perhaps in a way from a corporate standpoint, which is likely to be more robust. If it's an established platform, there's always the challenge of dealing with legacy issues. So both of the dental startups that I've done were literally just that. They were startups. Although in the case of my second business in mainland Europe, we did acquire two small platforms, but they were sufficiently early in the development that it was still possible to then drive growth in a more structured buy and build manner, and ensure that the investment in infrastructure in particular would be able to support growth and provide a platform for continued expansion. So I think, ingredients, choosing the right entry point, having the initial management team in place who are capable of dealing with the challenges of a business that's fueled by acquisitions, and clearly having the right funding, because buy and build is obviously a cash intensive requirement. There has not been, in my experience, any successful examples of buy and build platforms in either healthcare or education which were equity based. So it is very much driven by having great funding access, whether through equity investors or debt, or a combination of both.
Right. Okay. Yeah. Interesting. And you mentioned sort of whether you start as a startup or whether you buy a platform. How important is it to get that platform right? Is that sort of a critical part of that? When you sort of putting those ingredients together, is that a critical part of it? Because I suppose buy and build in theory gets spoken about quite glibly, but obviously the practicalities are somewhat different.
Yeah, and I think, as well as the platforms that I've built myself, I've also advised on probably around about 30 buy and transactions in the healthcare sector, covering dentistry, veterinary, and optical businesses. And I think the the challenge that often is perhaps underestimated is if you buy what looks like a strong established business, it does come with what I describe as legacy factors that you have to be very aware of and able to deal with. In some cases, they may be actually factors which make further growth more difficult, more challenging. And so it's particularly important when I look at an established business on behalf of an investor that I get a very clear sense of the management organization, how strong it is, how capable it is to drive a lot more growth, because there are very different challenges in growing from, say, a startup to 30 to 50 sites, and then going from 50 sites to 150 or even greater. And quite often the management teams in place need to change. And I know from the very first dental platform I built that the team I started with were entirely replaced by the time I got to about 40 or 50 clinics.
Interesting. Yeah, I think that's something that gets underestimated quite a lot. Certainly we meet particularly founders, I would say, who perhaps feel that they can work with the management team right from the start and they'll be right there till the sort of the end of the journey. But as we've seen, you kind of quite often those people need to be sort of moved and developed as they go, because it's a different kettle of fish when you're running a business of scale, isn't it? So
always. And one of the challenges quite often, one of these kind of legacy problems that I'm referencing is actually usually linked to the founder, because quite often there'll be an entrepreneurial individual, could be a dentist, could be a vet, could be somebody who actually started with a single nursery, for example, in the children's early years sector. And there is a degree to which the level of emotion investment of the founder is so high that it becomes incredibly difficult for so-called outsiders, new investors or new senior management, to be able to direct the business in a way which would be considered appropriate for future growth. So I think there's always a challenge in dealing with founder entrepreneurs. Some of them can be extremely flexible and pragmatic about the kind of changes they have to accept. But I think one of the key challenges that I've found when looking at businesses where there's a very strong founder entrepreneur typically in the leadership role, CEO or chairman, is that they are often less able or willing or aware of the need to invest ahead of growth in the sense of building that infrastructure and effectively expensing quite a lot of money in what is often regarded as overhead before they actually achieve the growth. And I kind of keep reiterating the same message. I find that too often when you think that growth can be driven just by bolting on new deal after new deal, you'll suddenly find that things start to become problematic because the infrastructure that's in place has not been good enough to, first of all, integrate new acquisitions effectively, but then secondly, to manage a greatly expanded organization. And so to me, it is axiomatic that when you're looking at a strategy built on a buy and build plan, there is a recognition and a willingness to put the investment into the business in terms of infrastructure. It's not just people, it's also that investment in systems, because clearly into today's business environment, the role of information management and controls, reporting, and so on is fundamental. And so if the systems are not in place to support the business that you're trying to become, then you will get lots of problems. And again, quite often in my advisory role, I've seen examples of businesses which have grown fast, but they completely lack the infrastructure. The data that they provide is often wildly inaccurate and unhelpful, and in some cases potentially dangerous in planning and managing the business.
Yeah, I think that's it's a very good point. I think that's certainly the successful buy and builds I've sort of seen over the years have kind of had that investment ahead of the scaling, and therefore you kind of buying businesses and putting them into your platform and driving out synergies and all that sort of positive stuff. And yeah, I think it's quite often people try and do it on a bit of a shoestring, and that quite often can get you so far, but often will come to a halt at some point. What I mean, I suppose one of the talked about the positives there and kind of what brings out the best in a buy and build, but from your experience, what are the things that sort of create the most problems when you're looking at a buy and build, or what might cause buy and build to fail?
The most common failure that I see is poor integration. So, being blunt, acquiring businesses in the kind of sectors we're talking about, healthcare and education, is relatively straightforward. I mean, clearly there are aspects to how businesses are valued and how the acquisition process is managed. But effectively, anybody with fairly, limited knowledge of corporate finance can buy a nursery or a dental clinic or a veterinary practice. The difficulty is if you're trying to create a scaled platform, is actually getting consistency of performance across the platform. It's about getting synergy benefits as the business grows. And if the acquisitions are not integrated, which unfortunately I see all too often, then those benefits are often not realized. And quite often people working in the acquired sites become frustrated and find themselves wondering why they were part of a group where they thought there'd be some benefits from being, in an organization which had a framework of support and systems and so forth, but doesn't deliver it. So to me, it's absolutely axiomatic when I'm, again, evaluating a group, a platform on behalf of an investor. I look really hard at the integration process. And if I see weaknesses, which I would probably say in half the cases are usually apparent pretty readily, I will be pretty confident that that business will struggle unless there are significant changes.
Yeah. Okay, interesting. And in terms of, I know one thing I've seen over the years is that certainly when people get funding to do a buy and build, there's that pressure to then, you've said you're going to grow, you said you're going to do so many acquisitions, and then you sometimes see management teams sort of start to change their sort of criteria around the acquisition targets to try and almost hit a number rather than, sort of be a key part of the strategy. Is that something you've come across? Have you sort of seen people make that mistake?
Yes, I mean, again, it's I won't say it's the most common mistake that you see, but it does happen. I think to a degree, often it's important that the investor, the controlling funder within that kind of business, make sure that acquisition discipline is maintained, because everybody gets very excited about the principle of multiple arbitrage being the basis on which you create value. But in reality, the best transactions, the ones in which the value outcome is optimized, are businesses which are integrated incredibly well, where there is a consistency, a representative view of what the business looks like, what it stands for, what represents a typical site. All of those things are fairly easy to identify during due diligence. And accordingly, the best deals are those which can demonstrate they've got that kind of, not so much uniformity, but consistency of proposition when they present their business. And I think where management teams begin to slide away from any kind of criteria which they have established as being the kind of preferred options for acquisition, the risk is it starts to damage the brand or the proposition. And quite quickly, owners, prospective vendors will learn, will see, because typically we're dealing about relatively small communities of sellers, that there are potentially issues around the business. And so I think for owners, particularly for the investors or lenders, they need to be very clear that if there is a view on what the group is intending to achieve in terms of representing what the business stands for, they should maintain that discipline. And even if to some extent it actually rules out a lot of acquisitions, that's usually a good thing.
Right, okay, yeah. So maintain that sort of quality threshold, the focus on strategy, and make sure you deliver that rather than just delivering a number in a certain period of time.